In 2018, colon cancer treatment for metastatic disease hasn't changed that much, to be fair. There are certain improvements that we're making. Certainly supportive care has gotten better, and our ability to handle patient toxicity has improved. I think to some extent we are at a bit of a standstill with respect to treatment options because we have exhausted, for the most part, the group of patients that may benefit from immunotherapy, which includes MSI. And that is a very, very exciting piece of data. And at this meeting as well, we're seeing exciting, prolonged responses and clinical benefit. Second to that, I hope now that we'll go back to refining some of the molecular targets and spend the next few years focusing on those, which include HER2, BRAF, and others, and start to develop treatment options for patients with these small subsets. The holy grail, which still exists, is to try to find a drug that helps KRAS mutant patients, and there's a whole surge of investigations looking into that, but those are probably not coming for at least another few years. But we are looking forward to those when they're available. The next few years, I think, are going to be important to tease out, in particular, whether there's any additional immunocombinations that might work in this disease. We already know that the only real role for checkpoint inhibitors in colon cancer is MSI. And now there's a huge wave of second generation, let's call them second generation checkpoint inhibitor studies in colon cancer, in which they're being manipulated with either chemotherapy or with other checkpoint inhibitors or other immunotherapy targets in an effort to turn some of these cold tumors hot. So that's really the emphasis these next few years, whether we can find a suitable partner, another area to go after. I think overall, my sense is that the next few years are going to be a bit disappointing in that regard, because I think it is not as simple as it appears to be. And we're going, hopefully, to go back to targeted therapies and start identifying new targets that may be amenable to certain drugs. Like there's big studies looking at BRAF inhibitors now. There's big studies looking at HER2 inhibitors now, and TRAC, and all these small little subsets, which admittedly are very small, are going to be probably teased out a lot more in the next year or two.